important time when the whole world, and especially all those who care for human health, rededicate their efforts towards fighting this one of the most common type of cancers that affect our women across the world. In India, also, breast cancer has emerged as a big challenge and has become one of the most common cancer among the women, and also one of the most common and critical cause of death among the women in our country. According to the National Cancer Registry of India, it is estimated that by 2025, there will be around 230,000 new cases of breast cancer annually in our country, with a notable increase among the young women being diagnosed of this disease. Breast cancer in India is more often seen in a younger population when compared to the Western people. A recent study by Apollo Hospital also reveals that over 25% of breast cancer cases now occur in women aged 40 or younger. Doctors suggest that this shift could be due to various factors, including lifestyle changes, rising rates of obesity, and many genetic factors as well. Keeping in mind this important challenge and the scenario, we at IHW Council has been at the forefront of cancer awareness, and especially focusing a lot on breast cancer awareness. And that is why we also rechristened this month of October as the Breast Cancer Action Month, which was initiated 3 years back with the effort from the people of the community and the healthcare fraternity, and also supported by the people at the policy making space. So today's program is especially focused on empowering the future and also looking into how we can educate young women on breast health and awareness, and thus we can tackle this growing menace of breast cancer in our country. So we have an esteemed panel of expert doctors from across the country with us today, joining in this special program, which is powered by Dr. Reddy's laboratory. We have with us Dr. Bhavna Sirohi, Director of Medical Oncology, Balco Medical Center, Raipur. We have with us Dr. Chirag Shah, Director, Department of Oncology and Hematology of Apollo Hospital. Dr. Neeraj Bhatt, who is the medical oncologist at Sterling Hospital in Vadodara, Gujarat, and Dr. Raj Nagarkar, who is MD and Chief Surgical Oncologist at SCG Manavata Cancer Center. We also have with us Dr. Anil Harur, who is the consultant of oncology at Fortis Hospital in Kalyan, and Mr. Sangram Shirke, who is the commercial head of oncology business at the Dr. Reddy's laboratories. So without any further delay, let's talk to our experts today and try to understand that how we can give an effective response to this emerging problem of breast cancer in our country. So let me go to Dr. Chirag Shah first. Dr. Chirag Shah, I also mentioned about a study conducted by Apollo, and you are at the helm of affairs in Apollo Hospital as well. Just to put a kind of a context for our viewers, what are the the emerging trends in breast cancer space? What are the prevalence numbers as of now, and how do you see them increasing going forward?
Right. So, I think as mentioned in that data, that was also our impression that we see a fair number of young women in our practice, and my estimate was that about 20% of the women that see are in this young age group. And this analysis shows that it is actually 25%. So it's pretty coming close to that. Also, we have other data sets like a recent article in Lancet, where it shows that the below 50 breast cancer rates are rising steadily in India since about 1990. And it has almost doubled from 1990 to 2020. So compared to the developed nations, that is still lower because of various reasons, but it is on a steadily rising trend, and that is the worrisome part. And even more worrisome is this disease in younger women where we don't have a good screening test. So, unlike for those over 50, and some might say over 40, but the mammogram does not work too well uh, under the age of 40. So, we are certainly seeing this trend of younger women. And when I started practice about 20 years ago, if I saw a young woman in about 30, I would have very low suspicion for breast cancer. Whereas today, uh, we if we come across a patient like this, we don't simply think of fibroadenoma or other benign findings, and we start considering that even this person may have breast cancer and do the uh, important workup and evaluate them as thoroughly as we would do for a 50-year-old. So there is clearly a change in the trend.
Yeah, thank you so much, Dr. Saab, for highlighting that the kind of shift we are seeing. You talked about the screening not being that kind of strong or maybe in use when it comes to women under 50 year of age. You talked about mammography as one of that because around the 50 is something which I think you are suggesting that people go for it. So, what is the standard protocol in our country when we are looking at, or when we see that this the problem is shifting towards the younger set of people? What is otherwise standard protocol when it comes to screening of breast cancer among women, and especially all parts of our country? Because mammography, I think, is much more institutional in that sense, and maybe only limited to certain settings of the country rather than the all parts of our uh, you know uh, nation.
All right. So good news I would say is that mammography is no longer limited to the institutions. It is now fairly widely available in the larger cities, where it is in private sector to a big extent, and even many trust hospitals. So it is not limited to very large institutes. So that is the one good part. But today, as we are talking about younger women more, there is no standard screening test for younger women, because when this disease started, it was more after 50 and 60 years in the Western world. And so all the studies done with mammogram were for that age group. And we also know that with a dense breast in younger women, mammogram does not work well. There we have MRI. But MRI cannot be used widely as a screening tool because that is still limited in availability, expensive, um, and it has not been studied as a screening tool where we start asking all young women to do that. So what I kind of personally recommend at this point is that we educate young women about the importance of breast health, detecting an lump and other abnormalities, the early signs of breast cancer, and we start understanding and shifting our focus to not only older women. So we should advise our gynecologist, family doctors, and all the healthcare workers that women around the age of 30, so after the age of 30, they should do a monthly breast self examination and a possibly a yearly clinical examination by a doctor, but at least an awareness that a painless lump, for example, the biggest problem is that because these lumps are painless, most people underestimate the seriousness, even in older, and they keep on postponing, and they would not rush to the doctor much faster. So we have to advise them that a painless lump needs evaluation, along with all the other early signs of breast cancer, but this being the most common. And that even if you have no other signs, even if all your blood tests are normal, you still need to be seen by an expert, and you may need a fine needle aspiration or a true cut biopsy, and MRI or whatever test your doctor decides. But the need to be seen by a doctor for a lump at any age needs to be highlighted very importantly. Because I think that would be the life-saving measure. Because as of now, the incidence is such, and we don't have any good screening tests. So we cannot start telling them go around, doing testing, because that would be unscientific and would create unnecessary
Burden.
many over testing and wrong biopsies. But those who have a lump detected should go to the doctor. One major mistake people make is when they find something like this, they go on their own, do some routine health checkup like a package of blood tests. And when all the blood tests come normal, they say, oh, I cannot have a serious illness because all my blood tests are normal. So
Yeah.
that's another thing, very important at any age group for any cancer practically, that the routine blood test can be completely normal in early cancer.
Thank you so much, Dr. Saab. I think it is very important message that uh, any kind of lump should not be ignored, and there has to be a very specific approach towards kind of screening it or consulting a right medical practitioner for the same, so that you can at least, if there is any possibility of possible malignancy, it can be detected early. Dr. Bhavna Sirohi has joined us. Dr. Bhavna, when it comes to women health and especially the cancers which are impacting our women, you have been at the forefront of kind of taking this fight very extensively in all your role, and we have been privileged to be interacting with you in multiple occasions. So when we come to breast cancer, and you have seen that how this whole trend has been becoming even more I think worse, but at the same time, I think the overall resolve of everyone is also increasing in terms of, or strengthening in terms of putting up the right fight and preventing this disease. How you have seen that awareness among the women about breast health or breast cancer as in a specific term, but overall breast health evolving and increasing in our country, or what kind of gap you still find, and what are the suggestions which you would like to recommend that which can help us making people more aware and active towards ensuring the breast health?
Thank you, Mr. Kamal. First of all, I must congratulate both IHW and Dr. Reddy's for doing this session on awareness, because sessions like this actually really help making a difference on ground level. Whoever is listening, I think one should take cognizance of the fact that, India is a low and middle income group country. We are resource limited. So what we can do and cannot do is very important. I have worked in a country with universal health coverage, United Kingdom, where, the minute I turned 50, just telling my age, I got a letter in the post saying that, you are due for a mammogram. But in our country, our government has taken steps which are brilliant, where they have started clinical screening for women aged 30 and over at CHCs and PHC level, which I think is a fantastic step forward. Our population matrix in India is young. So as Dr. Chirag said, we are seeing more and more women, young women with breast cancer. So when I started training in early 90s, I had women in their 50s, 60s, 70s. But today I have women in their 20s, 30s who are coming, who are at the start of their life. They are not married, they're considering marriage, they're giving exams, they are thinking of a career, they're thinking of fertility issues, pregnancy issues, genetics. So a lot of things come into discussion for these young women. So it's even more important that, we diagnose these cancers early. And the only way we can diagnose cancers early in our women in India and globally is if we are aware. So being breast aware, being aware about your breast is the most important thing. So women, I'm currently working in Chhattisgarh. On the poverty index, it's like the third or fourth in our country, one of the poorest states. And what I see is women are still coming with bleeding and fungating masses, where they come when the breast starts smelling and affecting others in the house. So, or they come with a hemoglobin of 5, which in breast cancer is unheard of. And that happens when, the breast starts bleeding. And this is the state even today. And 30% of the population in Chhattisgarh is tribal women. So we need to reach out in every corner of our country, not just, women who can listen to this, but other areas as well. So I think what we need to do is drive awareness sessions, both in rural, urban, and semi-urban areas. And also drive, I know the government is doing this clinical screening, which is, I think, good enough for our country. And it's brilliant that, clinical screening is being done. Somehow we need to scale it up and, do it in a coordinated way so that, we see whether the stage migration has happened. Today at Balco Medical Center, 70 to 80% of patients I see come in stage 3 and 4. So we have started an initiative where we are trying to see whether we can, change the dynamic and bring them to stage 0 or 4. And breast cancer is very much amenable to being diagnosed at stage 0 and 1. You can do a mammogram, where you can detect the cancer at a precancerous stage. From the age of 45 years and above, I would suggest women should have a mammogram done, a digital mammogram done, preferably every 2 years. And that also will lead to stage migration. And of course, be self-aware. There is a big campaign which has started from this Breast International group, which is called Save the Breast. So, if you diagnose cancer early, you don't have to actually have the breast removed. You can undergo breast conserving surgery. So, and you don't have to undergo chemotherapy also. Your treatment will be finished quicker. It will be less expensive. So all of these things we have to drive in our country.
Thank you so much, Dr. Bhavna. And yeah, it's very important to take this message to the grassroots level, as you are suggesting, and also highlighting the kind of scenario which is prevailing in states like especially Chhattisgarh, where you are the cases which you are mentioning about, that definitely shows that the lack of awareness is leading to ignorance towards or negligence towards the health, and which is leading to a more complicated problem, and it's even fatal in many of the cases. Let me go to Dr. Neeraj Bhatt. Dr. Bhatt, Dr. Bhavna talked about Government of India starting the PSC level, CSC level clinical breast examination, and I'm sure it is being scaled up also. What are the practices prevailed in your state, and especially Gujarat? What kind of is that screening of women in all sections of the society, or the kind of urban, semi-urban, rural? Every state has those combinations. So do you see that the screening mechanism or the standards are kind of getting more clear and compliant, or what are the gaps which you feel can be addressed in this space? Dr. Bhatt, you are on mute, I believe.
Yeah, I hope I'm audible now.
Yes.
So, as previous two speakers pointed out, breast cancer probably would be one of the most commonly dealt about cancers by oncologists, both be it surgeons, medical oncologists, or radiation oncologists. The incidence is on rise, and unfortunately, it is the younger population that are diagnosed more and more. In fact, the diagnosis of breast cancer has been sort of preponed by a decade in India, and the lack of awareness is what is hitting them. And most of the malignancies, as Dr. Bhavana ma'am discussed, are diagnosed in stage 3 and stage 4. The same scenario stands true where I am practicing in Baroda. Fortunately, I would say that in a literate class, the awareness about the cancer is increasing, and they are taking initiatives to get mammographies done. And there are many relatives who are now asking, what should we do now that our relatives have been diagnosed? So the consciousness or the awareness about breast cancer is increasing. Same way, the incidence of familial breast cancer, many patients are now proactively asking me, now that my blood relative has been diagnosed, so what should I do? So in literate class, yes, the awareness about cancer has been increasing, but unfortunately for those areas which are remote and patients are coming from rural class or labor class, they are still not unaware. And as ma'am pointed out, they usually present with fungating mass. And so until their disease disturbs their daily routine, they do not approach their doctor, maybe because of their financial constraint and for whatever the reason based known to them. So yes, increasing the awareness about cancer is priority. Government is taking steps, but I would say that they are still primitive steps. Unfortunately, in a resource constrained countries like India, and the fact that population is too large to handle these investigations, it's the self-awareness that probably should be stressed more and more. So my approach is whenever a patient comes to me, I sort of try to counsel the patients as well as relatives about the incidence, prevalence, and the fact that if disease is diagnosed in early stage, it becomes curable. And later stages, we can only control regardless of the advancements in the treatment are. So I feel that these steps government is taking, yes, they are appreciable, but then they are too primitive for prevention of cancer. So what I feel is there should be an awareness campaign that should be carried out by all the oncologists who are practicing oncology, and maybe we can supplement the efforts or complement the efforts that are being taken by government. But I do not have any concrete idea as to how to cope up with so much increasing incidence of malignancy that is being seen by us as of now.
Dr. Bhatt, certainly the point which you are highlighting about that increasing the awareness is one important thing, and then you're also mentioning that all oncologists, because they understand cancer more than anyone, and they also understand the risk factors which cancer bring along with that, or the fatality it brings, and how it can also be kind of reversed in that sense to save more lives if you are treating cancer early. Let me go to Dr. Anil Haroor. Dr. Haroor, almost everyone, this is very clear that young women are getting cancer in our country. And the problem is that despite young women are getting cancer in our country, they are also, in many cases, reporting late or seeking the medical care late, and which is in an advanced stage of cancer, not in the stage 1 or stage 2 kind of thing. How do you see that young women being reciprocal or receptive towards the awareness around breast cancer? Because and one of the challenge which we also face, that there seems to be a lot of information around us when it comes to breast cancer. It is not something which is unheard of. It's becoming, kind of much more a day-to-day kind of scenario. But still we saw that people are not, kind of moving from awareness to action. So how do you see that, young women being, because apparently young women also may be carrying the notion that, breast cancer or cancer kind of thing may occur after a certain age, as we have seen, and there are medical standards that, okay, you need to go for this after 40, you have a higher risk after this age, but it is shifting towards the younger age. So how do you see that younger women taking this message, and or we already have a gap in delivering this message, and how we can address it?
Yeah, thanks, Mr. Kamal, and thank you to your NGO and Dr. Reddy's for organizing this excellent webinar. I think this is one of the most important things to be done in the Breast Cancer Awareness Month, because I think the mantra for getting breast cancer, a successful breast cancer control program, is awareness, awareness, and more awareness. I think that is, to put a cliched Bollywood term. And that is exactly where I would put my thoughts about young women. Now, the problem I think in our country is, as Dr. Neeraj very succinctly mentioned, is basically there is information, and we are a diverse country. We have all sorts of people with all sorts of information. We have young girls who are working in the IT sector who are doing mammograms at an age of 25 and less sometimes, just because they have mastalgia. And on the other side, you have women of 30, 35 coming with fungating breasts. So we have that spectrum. So I have an NGO which has now done more than 7,500 mammograms in the rural areas around Kalyan. And what we have seen is that there is a need to take cancer awareness to their doorstep. It is not going to happen if we are going to do it. It has to be a multi-pronged approach. One of the good things that the government has done is initiating this through the Ayushman program and through the National Family Cancer Survey that they have done. At least we know what the problem is. When we sit here and we talk about breast awareness, the survey says that it is only about 0.9% of women who have actually participated in a breast cancer screening program all over India. That's the national average for us. That was the survey which between 2019 and 2021. So the figures are abysmal. So unless we make people aware that these are the signs and symptoms of breast cancer, and most importantly, that breast cancer lumps are painless. Now the problem is, why do I go to a doctor? मैं तभी जाता हूं जब मुझे दर्द होता है, या मुझे बुखार आता है, या मुझे कुछ तकलीफ होती है और my daily routine is disturbed. Otherwise, why should I go to a doctor? And that is the root cause where people do not want to waste a single day of livelihood, because a lot of them depend on that daily income for running their family. And that awareness to be taken to their doorstep through various PHCs, through schools, through their colleges, through these these Anganwadi workers who incidentally I think are the backbone of our rural healthcare system. We don't give them credit, but they are actually ones who have really done a lot of work in COVID. That is what we see when we go to PHCs and we work through PHCs. That is where we see the real effort, the real push towards awareness and implementations of our policies coming. And that is how we should create awareness among these young women, that even if it is a painless lump, you should go and consult a doctor.
Thank you, Dr. Arur. I think very important point is here that many times we do not seek medical care or medical intervention because we are not seeing any symptom which is causing any kind of discomfort, and that leads to that kind of overseeing this kind of disease. Let me go to Dr. Raj. Dr. Raj, so let's say in the case of a disease which may start its early presence without any symptom, and can quickly move on to the stages which can be worrisome or which can become a major complexity or complicated. What do you suggest? What are the best and most effective way for the prevention for the people? Is it the self breast exam, which has to be as essential as anything else when it comes to the women's health, or and especially the women who are kind of post-adolescent, and it's maybe start the awareness can start even before that, and or when they should start going for clinical breast investigations or examinations, as now Dr. Suroi mentioned that is being conducted in PSC, CSCs also in a very focused manner. So what are the the most effective way? How does one navigate this whole thing?
See, Mr. Kamal, to be in a place like Nasik, we operate almost 500 breast cancer patients per year.
Yeah.
In the last 2 months, I can distinctly mention about 3 patients. One is a 22 years old young girl, gave her MPSC examination, and after her MPSC examination, 3rd day, she noticed a lump in the breast. She got a sonomammography done. It was suspicious for atypical fibroadenoma. Walks into a cancer hospital, does a biopsy, and it turns out to be a malignancy. Second is a 24 years old MBBS doctor, 24 years old, preparing for a PG entrance, notices a breast lump, has a family history of breast cancer in her auntie as well as grandmother, reaches a hospital, gets a biopsy done, and gets it diagnosed. Third is a IIT graduate. She's another 24 years old girl, preparing for her she's in fact December she's traveling to US for her further masters. Notices a breast lump, reaches out to a hospital, gets it tested, and turns out to be malignancy. The unfortunate part is 22, 23, 24 years. Would we really think of it being malignancy? All 3 of them are educated ladies. All 3 of them walked into a cancer hospital to get themselves investigated. All 3 of them turned out to be triple negative breast cancer. So the bottom line comes down is education. I think, as Dr. Chirag mentioned, Dr. Bhavna said, that we know the days have gone. When I did my surgical oncology training, we know that breast cancer OPD, it was mainly a geriatric OPD. Majority of the patients were 60 plus and above. Now, a good number, a sizable number of patients, you say 25%, our data says around 28 to 30% of our patients are less than 40 years of age. But these patients who are coming, who are less than 40 years of age, the silver lining is a good number of them come with early stage breast cancer, unlike those who are luminal A type or B type of breast cancer who come in stage 3 or stage 4. So awareness, unless we educate our daughters about breast health, things are not going to change. We have to make it as part of the education system. Maybe in 9th and 10th standard, we are talking about the good touch, bad touch. I think at that point of time, we should educate our daughters that how to do a breast self-examination. Unless we bring about this change, we will not be able to pick up early breast cancers. At the same time, we have been saying that, okay, there is a shift to the left. We are seeing more and more breast cancers occurring at younger age. But why is it happening? We really need to deep dive into it. Well, research is going on as far as targeted therapy, immunotherapy is coming up now. But is it related to a lifestyle? One of those 3 girls which I mentioned about, although she is 24 years old, her BMI is very high. So is obesity one of the reasons? Is our lifestyle the culprit? Are our dietary habits more of refined fats, less of polyunsaturated fatty acids? Well, alcohol and smoking is not that uncommon in women as we used to think about. It is no longer a social taboo. So probably our lifestyle is making us more prone in a competitive world where women are more focused at gaining their professional career. And we also know about the fact that early onset menarche, late first child delivery, reduced duration of breastfeeding, all of them make the mother more prone for developing breast cancer. So I think time has come. We really need to go back to our roots and start discussing about this openly. Mammograms and MRIs and all these things are going to continue. But I guess we are still in a country where less than 1% of the population has an easy access to mammograms. Even if there is an access, there is a basic hesitancy that when you are asymptomatic, why walk into a radiologist clinic or into a hospital to get your mammogram? So
Right.
education is the main key.
Dr. Kamal, I have one extended question for Dr. Raj. Okay, so Dr. Raj, when you explained this very nicely, that younger age group is falling into the early breast cancer stages, and this is what exactly you're noticing in your clinical practice. The percentage is also increasing for the early age, encounters. You also cited the examples how the lifestyle changes and the obesity is also leading towards it. Have you noticed, therefore, urban and rural kind of split here? If the urbanization and the younger women getting into the different lifestyle and different food habits and alcohol and the smoking kind of habits, so therefore, are you seeing any kind of bias towards the urbanization of it?
Yeah, in fact, very rightly noted, Sangram. In fact, most of the triple negative and these early age breast cancers tend to happen in the urban population. They are more common in the urban societies. Because, see, well, it's again, even if we do not accept it, it's a social disease. Social disease in the sense that in a rural population, majority of the daughters get married off at the age of 18 and 19, and by the age of 20, 21, they're already having one or two kids also.
Agreed.
Thank you so much, Dr. Raj, and thank you, Sangram, for adding this follow-up question. And I think that highlights this whole issue even in more clarity. Apart from these three cases which Dr. Raj you highlighted, these are clearly an outcome of the awareness which has reached to these women, and they could kind of utilize that awareness and thankfully got into the right path of discovering this problem and also getting it addressed. Let me go to Sangram in this, at this juncture. And Mr. Sangram, awareness is something which I think all our experts are very, strongly recommending and also putting their weight behind it, that it has to, reach to everyone in as effective manner as possible. Dr. Reddy's, the institution you are representing, does a lot of, effort in this area. What are the platforms and programs you find most effective for reaching the most vulnerable group in terms of awareness creation or education, especially in a scenario where you are also seeing that there is a certain higher incidences in certain setting, whether it is urbanized sectors, settings, or in a rural areas also. A lot of cases, as Dr. Bhavna Sirohi also highlighted, and most of them are tribals, rural.
Right.
Those voices of the society which Dr. Raj highlighted,
right,
in urban area maybe may not be effectively there in the rural area. So how do you see then what are the most effective ways for institution like yours which they find useful to reach out to the people?
I think thanks to all the panelists here, I think some of the notes I had made it, probably that information was absolutely new to me. And more I'm listening to this conversation, I feel the awareness which is need to happen and we need to be driven, okay, it need to be think through very, very differently for a different populations. I think India is a very, very dynamic organization and dynamic country. We have a mix of urban, semi-urban, rural, and extremely rural kind of population. I think every society and every of the geography required to have a different tools in terms of reaching. I think I'm very impressed with Dr. Anil, what he said. I think he's driving all the camps in the rural part of the Kalyan and the exteriors of Bombay, which is excellent work because that's one of the ways of spreading the awareness. I think post-pandemic, what good things are happening in the country, that more and more doctors and more specialists are moving away from the metro towns and setting up their the hospitals and the infrastructure towards the tier 1 and tier 2 cities. I think this is a very huge task and probably we require to use each and every possible channel. I think we have a social media, which is actually required to be used very judiciously and very, very consistently. We require to have a physical connect with some of the population because that's more important because nowadays you have such a huge information flowing in the open space. Which one is right, which one is wrong, it's very difficult for you to have a control over that. So I think it's required to have a combination of all of it, okay? And you have an urban population, you have a rural population, the communication tools required to use for the urban population has to be different. I think it's a huge gamut of it. We at Dr. Reddy's, we have slowly initiating it. It's very difficult to reach out to such a huge magnitude, but I think there is one more smarter way of, I think Dr. Shah also proposed that we need to use some of the gynecologist section very smartly, by which whatever the footfall is happening of a younger women in those clinics, probably you can use such kind of places to increase the awareness. So it's a huge magnitude, and probably I think all the pharmaceutical companies, especially who are operating into oncology sector, should not be only think about the business perspective, but I think they need to get down on the ground and try to work towards the social awareness about the breast cancer.
Thank you so much, Sangram. So, 2-3 important points here. You are reiterating the point which Dr. Saha also mentioned about engaging the cross specialties, especially those who are the first point of contact when it comes to women health and the gynecologists. We'll try to talk a little bit more about it. Let me go to Dr. Sirohi, and one thing which Dr. Raj a couple of times highlighted about the triple negative breast cancer. Dr. Sirohi, for the benefit of the viewers, would you like to put a little bit more kind of light on what is this triple negative breast cancer, and is it more common among Indians? Do Indians have more kind of probability of this kind of cancer, and what are the ways to prevent it? How it is different from a common breast cancer, or is there any differentiation for it?
So I think that's a very good question. That we have 3 receptors on a breast cancer, which is estrogen receptor, progesterone, and HER2. So ER and PR are hormone receptors, and HER2 is a protein which is overexpressed. And based on these, if all these 3 are negative, we say patient has a triple negative breast cancer. So we have hormone positive breast cancer, triple negative, triple positive, or a HER2 positive breast cancer. So triple negative breast cancer is highlighted a bit more because it's seen more in younger women, and also it is more aggressive. It tends to, by aggressive, I mean the cells divide rapidly, and it has a tendency to recur. That means, even after treatment, there is a possibility of coming back. But even triple negative breast cancer is highly curable if it is detected in early stages. And yes, there is, because we have a younger population matrix, and it's more commonly seen in younger women. So there is a thinking that, possibly it's more seen in India. About 15 to studies have shown from about 15 to 30% women have triple negative breast cancer. But again, with the new advancements, it's very easily treatable. I would just like to highlight one point which Dr. Raj and Mr. Sangram spoke about. For our country, I think it's very, very important. Yes, first of point of contact, gynecologists and others as well. But for me, I think very, very important, India lives in villages. 70% of India is still living in villages.
Yes.
And the first point of contact is Asha and Anganwadi workers and the Ayush doctors.
Right.
So our campaign, our efforts, which we are trying to do at Balco Medical Center, we have a van and we go to villages and Bastar area and all those places. So we have to really engage with them because they trust them. They are the ones, the patients, the people go and meet and see. If they tell them go and have Ayurveda treatment or homeopathy treatment, patient is not going to come and see me. Whatever happens, they will not go and see a gynecologist because, they build trust over years and years of meeting them, treating them. And, most diseases are self-limiting. So this is one point I wanted to make. And also, Mr. Kamal, I'm really sorry I have to join another call. Is there anything else that you wanted me to bring out?
I will just make one statement on Dr. Bhavna's observation. I think, Dr. Bhavna, what you said is right. Okay. And I think post-pandemic situation. Okay. And I think ASHA workers are also actively involved in terms of getting the vaccination for the babies, right?
Yes.
I think they are the one who are influencing that population to go and get the vaccination done at PSCs. And therefore, the trust is already built.
Yes.
However, when we talk about the ASHA workers, they are actually meeting towards the rural section. And I agree with you. India lives in a rural part of the country, right? But at the same time, as you say, the propensity of falling into the early age cancer is also in urban sectors quite huge. And
yes. I mean, we have to do it together. Yeah.
Exactly.
Yeah,
so that's only a point I was having in mind. So sometimes our inclination doesn't reach to the rural part of the country. Okay, that's but obvious because we live in urbanization sectors. That's the only part of it. But I agree with you. ASHA workers are the important.
And the other thing I wanted to say is, the triple negative, I see a lot of women, most of the women I see are from rural area. And we see triple negative in those as well. I just treated a basketball player and she's 29, 28 and no risk factors. So we as a country really need to do research and see why. I mean, she plays, she eats healthy, she eats sprouts. I mean, she says she's vegetarian, she's never touched smoking, alcohol, nothing. And we are seeing that more and more. So we actually really need to do research as to why this is happening in such younger women, and whether it's the environment or it is, I mean, I don't want to say, but I think we really need to design a questionnaire and look at if something stands out and look at the molecular stuff as well.
Is it genetic? Is it like
no family history? Not at all. Not at all. And we do BRCA testing in all women less than 45 years of age. In fact, it's freely available to all women irrespective of their socioeconomic status. And most of them are negative, and there is no family history.
Can I add something over here?
Yeah, please, Dr. Raj.
As you rightly pointed out, we have to look at both sections of the society. The way Amit has been doing his work at Nasik, we run a program called as Arogya Sahedi. It is a women's health initiative, and in the last 5 years, leave aside apart that COVID span of around a year or so, we have screened more than 65,000 ladies. And we have a van, it's all women, except the driver, who is a male. The entire team is of women, where it's not only about the rural population, even in urban city, in the Nasik city limit, corporation limits also, women have a hesitancy to go to a clinic or a hospital and get themselves tested.
Yeah.
So usually these groups, they go and it's part of even some kitty parties are there. They organize in a small hall or somewhere where we just educate them about breast self-examination and clinical breast evaluation, which is done by trained nurses, which are then, or medical officers, which are there. And and as far as the rural part which is there, there is one incentive for ASHA workers, which many a time as doctors we are not aware about. The incentive is that if a ASHA worker takes a patient to a hospital where the patient is diagnosed with cancer, he or she, they are financially rewarded. The ASHA worker gets 500 rupees for diagnosing a cancer patient and taking to the hospital, and she gets around 300 rupees for conducting a ANC of a lady.
Wow.
So it's like, it's a social cause, at the same time it's a financial incentive. So we need, we interact very closely with the ASHA workers and the primary health centers, that okay, it's not only for the benefit of that lady or that family, it is actually comes in as a reward to you also for diagnosing them. So that also actually helps out. So many times as doctors we are unaware about this part which the government is doing for the ASHA workers.
Absolutely, absolutely.
Thank you so much, Dr. Raj, for so we in a way are also looking at that how these important section of our healthcare's pyramid, the ASA workers who are at the bottom of the pyramid, but are the most important, I think the aspect of it, because they are the first point of contact for a large number of society of our country. Dr. Harur, you have been involved in a lot of those camps and other things, and reaching out to those relatively unserved areas. How do you see that ASA workers can be leveraged in a more, or not only ASA workers, maybe the other healthcare professionals also, like Dr. Raj talked about, that even nurses helping in the clinical breast examination, even kitty party kind of settings also. So what kind of capacity building you feel are important to you leverage this kind of extensive and on the ground system, which can really make a lot of difference when it comes to early diagnosis or early the screening of breast cancer, or maybe breast health in general, and also making people more aware and compliant to something like monthly self breast examination? What kind of capacity building training you feel is important for that?
Well, I think you can use every help that you need, every help that you can get, because this is a humongous problem. And that is why I think these ground level workers, and I liked the statement that Dr. Bhavna had made about Ayush doctors as well. See, we must remember, for all our posturing, the problem is that the rural healthcare, the backbone of the rural healthcare is still the Ayush doctors, and they are the ones who are in direct touch with the local population. In fact, a lot of these PHCs are also actually manned by, what we see, are actually manned by the Ayush doctors as well. So what we have done as NGOs is to conduct awareness among these doctors itself, the people who run these PHCs. They are the ones who drive these programs. In fact, there is an incentive now from the government in order to conduct these camps. So every time they have this NCD month, the non-communicable diseases month that they have, and they call us and they conduct camps, and now it's become kind of a habit for them. Through this, the ASHA workers also get connected. They have to be made aware, since they are mainly involved with women's health. What happens is they conduct the ANCs and maternity services. What happens is they are in good touch with all the women in the household. They know each household also pretty well. And they, even in casual talk, if they come to know that there is something that is amiss, like for example somebody mentions that मुझे एक गांठ है और वो बढ़ती जा रही है,
Right.
so I think we have to incentivize these ladies to actually bring, I think what Dr. Raj mentioned. Similarly, for non-communicable diseases, under that program, if these people are incentivized to make a diagnosis and felicitated for their services, I think it will go a long way in really bringing awareness to the doorsteps of the population. I think the main thing is to bring all this information to their doorsteps. unless we do that, it is going to be extremely difficult. It could be done directly. It has to be done through social media, which we use extensively, and we have not. There is no dearth of usage of social media even in the rural population. I
Right.
think our digitalization of financial services has proved that our population is very, very, very amenable to utilization of digital information. So I think we must exploit that as well.
Yeah, certainly, Dr. Tharoor. So let me just ask the concluding question to Sangram. Sangram, awareness, last mile, I think the delivery of this kind of touch point services, camps, capacity building, a lot of those things which are involved
Right.
when it comes to tackling this kind of a problem. How do you see that, like organization like yours can contribute to them while also balancing the evolving marketing dynamics and the patient needs, which are kind of evolving? How do you see that organizations like yours playing a little bit more role in that?
I think it's very important for us to understand one thing. Going forward, okay, the patient is going to be extremely important, okay? And I think every organization required to bring patient centricity at a very top level. Until you understand patient and what patient goes through in such kind of serious connotation, it will be difficult for any organization to make head forward. Because if at all the patient is supported and catered with all the needs, okay, that patient goes through, because the cancer is such an entity wherein patient is not drained only the physiologically. It's an emotional drain, it's a physiological drain, okay, it's a mental stress, okay, at the same time financially also costing these patients to a greater extent. So unless and until you support this cohesive kind of environment to patient, and you have to some kind of have intervention, how can you be a partner with the patient in entire journey? Okay, so it's not that you just start screening, get the patient diagnosed faster, early, and leave the patient halfway. No, so if you are going forward and getting the early diagnosis for the patient, you have to be a partner with the patient throughout the way. So going forward for the most of the pharmaceutical companies, it's going to be a very, very interesting journey, unless and until you provide all these platforms, which is going to help patients from the comprehensively. I think that is going to be important factor for most of the organization. We at Dr. Reddy's, we have already one digital platform, okay, and that digital platform is going to help all the breast cancer patients to be a little more connected, not only like, having it just for sake of having awareness, but a lot of other kind of interventions. We also have introducing certain pill plus kind of initiatives. At a free of cost, we're going to provide them scalp cooling kind of facilities. And the third most important thing, we have a Doctor Foundation, one entity, which actually doing a free of cost physical sessions with corporates in terms of bringing a lot of awareness around breast cancer. So these are the three things which we have initiated, but I think there's a long way to go and we will keep on evolving ourselves in that context.
Thank you so much, Sangram. And I think the most important takeaway from your point is the patient centricity which you are advocating, and which is something we need to bring in, and especially when it come to cancer care, because the cancer patient, as you said, fight on multiple level, and they kind of suffer at multiple level, and not only them, even the whole family sometime or most of the time.
Exactly.
Go through in this journey. And there it is very important that the patients are empowered in a manner where they also take charge of their treatment. So that is something we as a council very, very extensively and passionately advocate for. Interestingly, and I would also extend this invitation to all our audience to connect live on that, to understand more about patient centricity and how patients need to be the center of all the healthcare decision. And since Dr. Anil is in Mumbai only, I would, and Sangram and Dr. Raj also, I would extend my invitation that we at IHW Council is hosting a major program, the second edition of Patient Centricity, Patient First Summit in Mumbai on 3rd of November. to discuss more on this aspect, to kind of look into that how we can make a healthcare system which is more centered around the need and aspiration and expectations and limitations of the patients, many times. So thank you so much for today's insightful session, Dr. Raj, Dr. Harur, and all our experts who were part of this session. And thank you so much, Sangram and Dr. Reddy's, for helping us put together this session. And I'm sure we will continue this journey of spreading awareness and strengthening also the care in our country when it comes to breast cancer or cancer in general. To our viewers, please do take good care of yourself, or ensure that the women in your family are more aware about their breast health. We as a family can talk openly about breast health. We can encourage the women in our life to go for the regular self breast examination, and when it possible, also on a intervals for a clinical breast examination. And if they are above 40, and as the doctor suggested, they should also go for more institutional approaches towards mammography and mammogram and all those. There are enough tools, enough provisions, enough technologies, enough treatments are available. The most important thing is that we need to be aware about our health and seek the intervention and care at the right time before it's too late. With that, thank you so much, all of you, and have a good evening ahead, and a wonderful the festival of Diwali. Thank you so much.
Thank you, Dr. Thank you so much.
Thanks.
Thank you, Dr. Anil. Thank you, Dr. Raj.